Right now, the medical field is highly focused on patients in the ICU. But what about after the surge comes to an end? As part of our coverage of the rebound, we're taking a look at the role primary care doctors will play in the next phase of this pandemic and why these doctors are already in high demand in Wisconsin. Here's Sean Gallagher.
A state report released last week says there's a shortage in primary care physicians in Wisconsin, a position that's going to be much needed in the recovery stage of the pandemic. While the state is counting to make sure it has enough hospital beds and ventilators, a new report by the Wisconsin Legislative Reference Bureau shows there's a 40% shortage of primary care doctors and that the state needs 150 new physicians to fill the gap. Kenosha and Walworth counties are at a full shortage, while Milwaukee, Racine, and Washington counties are at a partial shortage.
I think it's going to be important to track, the ability to provide primary care services once the shelter-in-place orders are lifted and people start coming in. It will be important to see where we have gaps.
Dr. Leonard Aghetti at the Medical College of Wisconsin tells us primary care doctors will be key in the recovery phase of this pandemic.
There's going to be a rapid, surge in need for regular clinical services, and primary care is essentially where most of the entry point for most patients.
A shortage of doctors means people could have to wait longer and travel farther to see a doctor for basic checkups. Dr. Aghetti tells us the Medical College of Wisconsin is trying to make primary care positions more attractive by reducing student loans and shortening medical school programs.
We have a lot of programs now, pathways in medical school, that really allows us to expose these individuals very early on into the primary care fields.
It's something Wisconsin needs, as another 740 primary care doctors are expected to retire in the next 15 years. Dr. Aghetti tells us one positive from this pandemic is doctors are adjusting to telehealth. That could be a big benefit in closing the gap, especially in rural communities where people have to travel farther for basic health care. In Milwaukee, Sean Gallagher, TMJ4 News.
Sean, thank you. Doctors will play an important role in keeping us healthy in the next phase. But you also need to stay healthy right now. If you are struggling with stress or feeling isolated, we have resources to help manage pressure right now on our website, tmj4.com/rebound.